the huge difference or main difference between cryo and radiofrequency is that when we are doing cryoanalysis, we are only actually freezing the axons. We are freezing the intracellular water into the axons, and then we provoke the axons breakdown. Afterwards, we create the process which is called Wallerian degeneration. And when this, let's call it like inflammation process, starts up, so we have the macrophages come in and clear this debris, and then we actually have the start of the beginning of the regrowing of the nerve, which is happening 1 to 2 millimeters per day. And the difference between cryo and radiofrequency is that with cryo, you cannot actually cut the nerve. This is where the problem with radiofrequency actually comes. And then the other thing is that with cryo, we cannot provoke neuritis or inflammation of the nerve, because, and this is where this condition is very difficult to treat when we do radiofrequency. So that's why this is one advantage with the cryo. The other thing with cryo is you can use cryo actually everywhere on the body, on the small nerves, on the sensory nerves, motor branches. We use a lot of cryo for spasticity at the moment on the motor branches of the nerve, intramuscular branches, and we can see actually that the nerve grows back. There is no risk of freezing the surrounding tissue because there is a huge temperature, a heat exchange between the cooling effect and the warming from the arteries. Sometimes we add some additional water, saline, or some local anesthetics in order to create bigger lesion. But usually it's enough to just to freeze the nerve and then we use the intracellular water of the patient. So we don't add any other condition. The other advantage of cryo is that cryo is you can control the cryo because the lesion is actually controllable because you have only 1 centimeter or 1.5 centimeters where you freeze. With radio frequency, you cannot control the heat. You cannot point the heat in direction where you want to be. With cryo, we are very, very limited actually on the nerve, and then we are freezing the nerve. Because of the temperature gradient, we cannot freeze the fat tissue, we cannot freeze the muscles, we cannot freeze the vessels because there is blood circulation. So when the blood circulates around the cooling effect, so it's actually it takes the cooling out or away from the place where we freeze. So that's why the risk of freezing is very low.